Not once did he leave me without any teeth in my mouth, without feeling like I couldn't do my job. And working with the public one-on-one, I sell jewelry, so it's pretty personal. And all through the transition, which was months of work, never did I feel like anybody could tell that. I don't think even any of my coworkers can tell that these are not my teeth.
The teeth by tonight concept was something very attractive to me. Again, with my interactions with what I do for a living, and that a lot of communication, interaction with people as far as lunches and so forth, and even giving speeches and interacting with employees, directions and so forth, that it was very important. I conveyed to Dr. McKay that, I couldn't go a long period of time without teeth. It wouldn't work well. And so he assured me that his process and the steps that he did, that he would keep that to a minimum. And, I had major work done with mine for both upper and lower implants.
I was never without any teeth. There was always, temporaries put in until the real thing were done. So, I mean, it's a win-win situation.
It was actually a matter of walking in there, having the procedure done, and coming out with a smile.
They won't let you leave looking like the Wicked Witch of the West or something. No, they get you teeth.
Well, the ones I've done in the past have been an individual tooth, and I've had to go in and had it worked on. It'd take a couple of hours, pretty much shoot the whole day. With Dr. McKay, I went in and had a lot more work done in pretty much the same amount of time. I'd go in and dedicate a day to going to the dentist, and the results were exponentially greater.
Because I live farther south from Seattle, a good 45 miles from downtown Seattle, it was a concern of mine how many times I would have to make the drive up there to have everything done that needed to be done. And so the little bit shorter time frame, the lesser number of visits to the office was something that was important to me as well.
I can't say enough of how they minimize any kind of fear to have it done. And you're being handled by a professional, and that really makes a difference too. And what I really appreciated was how Dr. McKay was sensitive to my time frame, that I couldn't be out, frankly, with no teeth for a week, 2 weeks, 3 weeks. It was all this was done in a matter of days and increments, to where I did not have to lose a lot of time from work or my social life, being exposed without teeth and that was something I feared greatly, and he accommodated me all the way through the process with that, and I was amazed by how he did it.
Because once everything was pulled, I had the whole top done all at the same time, and once the teeth were all pulled, I did have teeth by the same day. I mean, I was back at work in 3 days. I thought I was a slow healer, but I was done in 3 days. And I went back to work after 3 days, after having all of my top teeth pulled.